Hi, I'm Kristen and I'm a pregnancy coach that works with pregnant women all over the world. I help you go from anxious and overwhelmed to really enjoying your pregnancy, preparing for a sacred natural birth, and giving your baby the beautiful beginning that you're dreaming of. Today, I want to talk about the consequences of pregnancy complications. That may seem a little bit self-evident, but I think that we have almost a cavalier attitude towards pregnancy complications in our culture because the perspective is pregnancy complications just happen. It's just bad luck in most instances. And there's a doctor who's going to ride in to save the day and fix things for you and your baby. But the problem is that pregnancy complications can literally have a lifelong impact on your baby. When there are complications during pregnancy, they can impact your baby's health throughout his or her lifetime. Oftentimes, physical health is greatly impacted. For example, if you develop something like preeclampsia or gestational diabetes, those can have an impact on your baby's body and systems throughout their entire life, including things like blood pressure and obesity. So complications can really have an impact on your baby, not just in the womb, but throughout life. Complications can also impact you. Having particular complications like gestational diabetes predisposes you later in life to having complications like diabetes. Now, it's somewhat of a chicken and egg scenario in that was it the gestational diabetes or the factors that led to the gestational diabetes? But regardless, we know that having particular pregnancy complications predisposes you to having more health complications throughout life. I would argue, though, that even more than that, the true cost of pregnancy complications comes in what it takes from you on a mental, emotional, stress, even spiritual level. When you have pregnancy complications, first of all, you feel like some of the joy is gone from your pregnancy, and there's the stress of worrying about the complications and worrying about your baby. There's also some control of your experience that's taken from you because you go from this happy, carefree mom who's waiting for their baby to being worried about all these things and having all of these experts, your doctor, your midwife, or maybe even specialists like a perinatalogist or a maternal fetal medicine specialist coming in to say, okay, well, you need to do this and you need to do that, and now we're going to do this and now we're going to do that. And some of that advice may be good and some of that advice may actually not be good. We're not going to debate that really right now, but just know that sometimes advice isn't based on evidence. But you have all that control taken, and all of a sudden things that you thought, okay, this is what I want to do, this is the kind of pregnancy that I want to have, all of that gets wiped off the table, and it often gets replaced by language such as, they won't let me, or they took the baby. These sorts of things they send a chill up my spine and they make me feel sick to my stomach because it's they doing to me, and that is fodder for trauma and difficulty. Even if we had an experience where a pregnancy complication happened, but the care was collaborative, it would be really different. But the sad thing about pregnancy complications isn't really that they take all of this away. It's that most of them are preventable. Pregnancy complications don't just take away your power in the moment. There's actually a loss of power and understanding and knowledge that came before the complication happened. It's true that some complications are unlucky. They're just unexpected and they just happen. But it's also true that many complications are preventable. Even complications that they say that we don't know the cause of them and how to prevent them. Well, research has shown that there are things that can be preventative and that there are things that we could do. So it's important to have knowledge and understanding. And it's also important to realize that this isn't just a roll of the dice. It's not just a spin of the roulette wheel. There's so much that you can do. And if you take the steps to prevent pregnancy complication, most of which are diet, movement is important as well, but diet's really important. Diet, movement, stress relief, just changing your lifestyle, doing the inner work, which is, I know that's a little nebulous to say, but giving yourself the space to do the mental and emotional work, even the spiritual work that comes with this big transition, and honoring the fact that it's a transition. All of those things go into creating a healthy pregnancy and preventing complications. And even if a complication arises that was not preventable, you and your baby are so much healthier for it. So there are great benefits. Pregnancy complications have high cost. One of the biggest things that has a high cost is ignorance about how do we prevent those, or when we've got them going on, what can we do to mitigate them outside of just medical procedures? Is there anything else that can be done? Because often there is. There are often, as they would say perhaps in the medical world, complementary therapies. So as a mom, you deserve to have a good experience. You deserve to feel empowered, to feel like you're collaborating, to feel like this care is something that is being done with your care provider, not being done to you and your baby. And you certainly don't want to get the feeling that somebody else is calling all the shots and taking your baby. You want to be part of that experience. Sometimes it can feel really overwhelming. How do I sort through all the evidence, Kristen? Where do I even start? Because if I ask, how do I prevent pregnancy complications, my doctor's probably going to look at me like I just grew an extra left foot. The truth is that's just not the paradigm that they operate under. Doctors, preventative medicine, they just often don't go together. That's where I come in as a pregnancy coach, and I can help you figure out, okay, what are ways that I can stay low risk? Especially if you had a complication in a past pregnancy, we can take a look at that and start designing a plan that will help lower the risk of developing that complication in a new pregnancy. Or even if you know that it's likely that something's going to occur, again, there's so much that you can do to mitigate those effects and grow a really healthy baby besides that. I'm also there for you to help you have that support, somebody to sound off of, somebody to reflect and to listen to you so that you know that you're being heard, that you're being understood, that you're being respected, and that your voice is valuable. That's what so many moms want, and that's what I'm so happy to do. I'm there for you throughout your pregnancy. We're talking face-to-face via Zoom regularly. I'm in your pocket, on your phone. You can send me a text or a voice text anytime, before an appointment, after an appointment. Whenever anything is on your mind, I am there for you. If this level of support sounds good to you, head over to birthbabylife.com/beautiful. Let's plan a time that we can talk this week about how I can support you.